Hello, I'm Betty. I'm Betty Kitchener. I'm a Rotarian at the Rotary Club of Flemington, Kensington. And I'm also the co-founder of the Mental Health First Aid program. The other co-founder is my dear husband, Tony Jorm. He's a researcher at the University of Melbourne. My background is in teaching. I've done counselling. I've done a variety of things. My last job has been CEO of the Mental Health First Aid program. And together we got the curriculum going at the turn of the century. Well, it all started actually on a dog walk before the turn of the century. And we came up with this idea that teaching first aid, as I did in my spare time for Red Cross, didn't really tell anyone about mental health problems, which are as common, if not more common, than many of the physical conditions that we learn about in first aid courses. And I have just had fire in the belly about getting a mental health first aid program out there so that everyone in the community can recognise if someone is troubled with a mental health problem and know how to give the first aid. We all think it's a great idea to go off to a Red Cross St John's first aid course and learn those skills. Why wouldn't we? And in the same way, we need to go off and learn mental health skills. They're not hard. A lot of it's common sense, and it can make a world of difference. We have ALGEE. That's me, algae. And that is, and I'm going to read it, approach the person, assess and assist with any crises, listen and communicate non-judgmentally, give support and information, encourage the person to get appropriate professional help, and encourage other supports. In Australia, there are a lot of pathways to care in the mental health area. So as a first aider, we just have to have at our fingertips what can help. You know, could the person go to a GP? Could they go to a clinical psychologist? Could they go to Headspace? Could they go somewhere else to get some help? Could they go online? There's amazing evidence-based programs online that people can go to. Not the Mental Health First Aid Australia has got a number of courses going. The very first one that we developed was, we called it adult. It was adults helping adults. And then we got one that was youth, which is adults working with teenagers. So that course is for parents, teachers, youth workers, sports coaches, etc. Then we got an Aboriginal mental health first aid course. It's only delivered by Aboriginal people to Aboriginal people. So there's a great understanding of the cultural nuances there and understandings around mental health and wellbeing. We also have a teen mental health first aid course, which is taught to teenagers, very often in a school. And then I was involved in developing the older person mental health first aid course. Very fitting, I'm now over 70. So there are a few different things you do. I mean, depression, anxiety is still there in an older person, but there are some other things that may come up as an older person, and what's the mental health first aid that we offer there. It's so important for the community to know about mental health. Mental health problems, depression, anxiety, substance use disorders are often so much more common than physical health problems. And also there's stacks of evidence to say that if you have a chronic physical illness, such as diabetes, maybe heart disease, it's on the cards that you're also going to have some depression and anxiety. So we really, really need to know right across our community what to do. We can't always run to the professionals. There are a lot of things to do, even exercise, getting out with a friend, connecting with a friend, exercising. I really encourage you to do a mental health first aid course if you can, to improve mental health literacy and the wonderful help that you can offer to friends. Thank you.